I completed the first aid training from the fire department and received a certificate of completion.
Wow, Mom, congratulations!
For our family safety training this month, we have Mrs. Junbi Hay, who will be teaching us about how to perform first aid for various illnesses and diseases that may occur during a disaster.
Yes, sir.
1. Burn injuries from fires.
First aid. You should check out the patient's condition. To do so, you must know the severity of the damages and past medical history. Also, you must wear protective gear, such as gloves, to prevent any infection. When you are performing first aid on site, you have to consider the safety of the victim and yourself. First of all, let's learn how to perform a first aid on burn victims, which is a common type of injury at a fire.
I'll do the patient role.
The most important thing is to evacuate victims from the area of the fire so that the injury does not get worse. Then, you must prevent victims from taking a breath of heat or smoke. I guess the next step is to take the patient's clothes off quickly. Yes, but while you are removing clothes covering the burn, you must not force them off. Instead, you need to cut away the surrounding areas using scissors. Then, you need to dip the burnt area in cold water or cover with cold bandages. But this may lower the body temperature too much, and this treatment should last for more than 10 minutes. Then, cover the injured area with thick sterilized gauze. Applying alcohol, Vaseline, or oil may increase the chances of infection later and must be avoided.
I guess we have to wait for 119 paramedics if it's a severe injury, like a third-degree burn, where the full thickness of the skin is damaged.
If the burn is so severe that the victim is unconscious or victim's pulse and breathing are becoming weak, you must take the victim to the hospital immediately. If the patient has facial burns or has inhaled smoke, the patient may have airway burns and may have a hard time breathing. In this case, you just provide oxygen and take the patient to the hospital.
What about blisters?
If you pop them, it may result in an infection, so always leave them as they are.